Welcome to the Green Table Talk. I am your host, Janine Johnson. We're going to talk about advocacy, the ACB community.
I've been a patient myself, and I've been a victim of some of the things that we're going to talk about, which has fueled my passion. I actually developed a tool to help patients prepare for their appointments. I use like the ABCs of Advocacy. The A stands for adjust your attitude. So go in there with an open mind. The B is for bringing backup. Bring somebody with you. C is for have a concise conversation. The tool that I created helps them prepare for their appointments, so that you can go in there and really maximize the amount of time, because the minute you're talking for too long, like they're gonna miss things. I am a registered nurse by background. I'm an ER nurse, and now I'm a travel nurse. We sent a letter to the federal government being like, hey, Justin Trudeau, like, you're not collecting race-based data and you need to because of this reason. And they actually responded to us, which was absolutely amazing.
Welcome to the Green Table Talk. I am your host, Janine Johnson. Today I have the pleasure of speaking to my friend, Kamika Sylvester. Kamika, welcome to the show.
Thank you. Thank you so much for having me.
Of course, of course. Today we're going to talk about several items here. We're going to talk about the ACB community, how they feel towards the medical sector, the misgivings that they have towards the medical sector. We're going to talk about what you've experienced as a nurse speaking to the ACB community, and just the gambit of things, just a gambit of things. But before we start, I'd like you to introduce yourself and give our audience a little insight into Kamika and your hobbies, what you enjoy doing, all that good stuff. Let us know.
Well, a little bit about me. I am a ER RN. I'm a travel nurse as well. So I'm licensed across 4 different provinces in Canada. So I've been doing that for a few years. And of course, like being from Ontario, but like going to other places, I've seen quite a few things. I'm very passionate about healthcare. I've been a patient myself, and I've been a victim of some of the things that we're going to talk about, which has fueled my passion. So I've co-founded a nonprofit called the Black Birth Project, which is looking to essentially improve reproductive health outcomes for Black women across Canada. I also have a company, RennelCo, where I'm looking to not only empower nurses and future healthcare providers, but help organizations, students, and young professionals position themselves strategically. I do mentorship. I teach patient advocacy as well. So definitely a lot of things around healthcare, looking to improve the system as we know it. And when I'm not doing all those things, I am usually on a beach somewhere. I am of Jamaican parents, so as much as I was born here, I need the tropical weather. So I'm an avid traveler and just like to see other parts of the world in my downtime. So that's a little bit about me.
Beautiful. That's amazing. You have your hands full, my friend. That's why I'm so happy you are here, because you've got that insight. You've got that knowledge. So I'm happy you're here. And as for your travels to Jamaica, listen, I could use a vacation too. So anytime you're ready to go, let me know, because I would love to see a
It's
beach.
on my list for sure.
Okay. Thank you. Excellent. So, as I mentioned, we're going to talk about racism in healthcare. So, since, like you said, you've seen a lot, you've heard a lot. Let's talk about this. I've jotted down a couple notes. Give me a description, in your opinion, about racism in healthcare. What's the different type of racism someone from the ACB community can experience?
Well, I think that the easiest way I would be able to break it down, I would put it in sort of micro and macro aggressions. I think a lot of us are familiar with microaggressions, even in the workplace. The healthcare is no different in terms of just seeing like little instances, little comments, looks. And a lot of times, like, I feel like my patients and even myself, you can't necessarily put it into words, but you feel this sense of discomfort.
Mhm.
It could be the way that your doctor looks at you when you say you don't eat certain, you say when you say you eat certain foods and they're like, you're diabetic, you probably shouldn't.
Mhm.
Or just little assumptions that are made about you just because you are from the ACB community. So I think like there are sort of, I would place those on a micro scale, but macroaggressions sometimes can manifest as literally blatant dismissal, disregard, refusing, um, just sometimes even blatantly like calling us racial slurs.
Mhm.
it's definitely all encompassing. Like there's so many different things that we experience in the healthcare system, which has led to a lot of mistrust, a lot of trauma, definitely a lot of reasons why I think individuals from the ACB community, and this is what I've heard, would rather die than seek healthcare. So that is really part of what I'm trying to change because
Mhm,
I think that everybody has a right to a certain quality of life. Everyone has a right to live and not just live and survive, but thrive. And I think
mhm,
that our healthcare system needs to do better, ensuring that we are protecting the most vulnerable patients. And I think the ACB community, we are some of the most vulnerable populations, especially when you look at the intersections of our identities.
mhm. That's very sad to hear that someone actually said that they'd rather die than just go through this process. That we live in Canada, like you know what I mean. We're a thriving country. We have healthcare system and everything, but for someone to say that, that's sad. That's very sad and unfortunate. Do you feel that if there were more ACB healthcare like professionals, like more ACB doctors out there, that would help eliminate some of this? Like, do you feel that the ACB community will be more trusting of the medical system? What are your thoughts on that?
I think that not just I think there are statistics that prove that the health outcomes for the ACB community are significantly affected when there is an increased representation. There's a lot more trust, a lot more understanding. I think we throw around the word cultural competence, which I have a lot of thoughts about that because I don't think it's necessarily possible to be competent in someone else's culture,
Hmm.
especially because there's so many nuances. All I'm like I said, I'm from a Jamaican background. Not every single person who is born and raised in Jamaica, their health might look very different. Their views on healthcare might look very different. So I think it is not necessarily as important to develop a cultural competence, but have an openness and a willingness to understand the patient that you have in front of you and
Hmm.
let them be the ones to dictate that. But I think that a lot of patients struggle with being bold in saying what is important to them and what health looks like for them and defining it,
Hmm.
when the healthcare provider on the other side doesn't look like them. So I think that the representation, they feel a lot more cared for. There's a bit more understanding in terms of the values, the shared values of our community. So I think that they just essentially are more attentive,
Hmm.
are less likely to dismiss someone's feelings, or they're just more likely to dig deeper and ask the questions and take the extra time, because they know what it's like to be on the other side,
Yeah.
or they might have someone in their family that looks exactly like their patient in front of them. So
Hmm.
that increased representation is important. The data shows. Um, it is just there's so many barriers as to why we don't have that representation, which is something that we're also trying to address, in a lot of the
Hmm.
initiatives, that
Yeah.
my nonprofit and my company that we're doing.
And I'm looking forward to talking about your nonprofit as well. Um, do you feel that if there was more education, because I know, first of all, one of the things that, especially the older generation, they experience in terms of speaking to healthcare professionals, doctors, et cetera, that's not of the ACB community, is language. For example, my mom has a strong Trinidadian accent. I'm Trini to the bone, Trini background, right? My husband's Jamaican, but sometimes her accent, they say, it's just a strong accent, such a strong accent. And to me, it's not because I talk to her every day, but I know there's a lot of healthcare professionals out there that they won't understand what she's saying, or someone who's been here, who hasn't been here for a long period of time. Some doctors will just dismiss them because of the fact that they can't understand them. So do you feel if there's more education, specifically with people that's not from the ACB community, the doctors and the nurses that's not from the ACB community, do you feel there was like more education? I don't know if there's like programs or anything out there. I haven't really looked into it, but more education on their end. If there's like seminars that the hospitals could provide, how to deal with the ACB community, how to because there's a lot going on in our community, and I'm not putting down anybody else, but there's a lot going on. So the question is, do you feel that there's more education for those practitioners that are not of the ACB community, more education on the ACB community? do you think we'll be more willing to go to them? We'll be more willing to trust them in terms of, our health?
So I think your question I think my answer is yes and no. So
Mhm.
in terms of the example that you gave about having an accent and like the dismissal, I don't think that necessarily having like more education will help in that in particular. I
For the
think
language
so
barrier.
like I think it's more so like a mindset and an attitude. I think it just really boils down to that attentiveness and being willing to be patient.
Mm.
I don't know if you can teach patience. I think that those of us who come into the healthcare field, I think that it is a requirement. You have to be patient with your patients.
Mhm.
So not everyone's going to speak the same language. I've worked with patients who've had strokes and who have aphasia. And if you have expressive aphasia, like it can take quite a bit of time to get your words out. It doesn't
Mhm.
mean that you don't know what you're saying or that you don't understand. It just requires time. So I think in that same regard, where there's language differences, or you're using terminology that they may not understand, you have to one, be willing to meet them where they're at, be patient, and have that sort of attentiveness to what they're saying, and not be so quick to dismiss.
Mhm.
So the second part, I feel like that you're asking towards the end of your question as to that comfort level. Will patients be more willing to, come to different practitioners? I think yes, having education about anti-Black racism, having that understanding as to um, the generational impact of from slavery downwards, the trauma, how that manifests physiologically. So, like, how does the stress that our ancestors experience, how does that even manifest in my body today? And I don't think that a lot of practitioners realize, even though there's so much data to support sort of the connections between stress and like hypertension, you have high blood pressure, which is like a precursor to cardiovascular disease, things like that. Like everything is linked together. So undergoing a lot of the things that our community is like experiencing, where it's like you're experiencing racism, poverty, there's micro macro aggressions, you're at work and you're experiencing different things like discrimination, um all of
It's
those
a
things
lot.
impact our health, right? Not having
Mhm.
access to quality food, with sort of the things that are going on, adequate housing, all of those affect our bodies. And if you understood what some of your patients were facing, you may have a different approach to how you care for them. And you'd probably be more willing to work with them as opposed to just slap a prescription down and say next, when you really haven't met their needs whatsoever. So I think having an understanding of anti-Black racism specifically, because I think it's very unique, um, is important, which is something that our nonprofit is looking to do. We're looking to develop anti-Black racism training for healthcare providers to really help them understand and identify, do you have bias? Like, I
Mhm.
don't think a lot of them, it's called implicit bias for a reason. So I'm not sure if they're aware, but to try to bring that to their attention, like, does that impact your practice? And if so, something needs to be done because you could be causing harm to your patients.
That's amazing. That's amazing. I'm glad you said that. I'm glad that's what your organization does because, like you said, most of the time doctors just figured, you know what? They're not listening to their patients, first of all. And like you said, just slap a prescription down next. That's 100% correct. That happened to my mother. Once again, she went to the doctor and she's explaining this is what she's experiencing, and they just give her pills. It's just like just pump her full of pills, that'll fix your problem. But you
Yeah.
don't even really you're prescribing something. And I got so irritated with this. They're prescribing something to my mom and they don't even really know what the problem is. Did you listen to what she was saying? Did you hear what she was saying? And they just gave her a prescription and that was it. Come to find out she didn't even need the medication. She didn't take it, by the way. She didn't even need the medication. And it was something that didn't even require medication at all. So you're gonna pump my mom full of medication and drugs because it's an easy out, right?
I
So
want to talk about that for a second because that is probably one of the most common things that I experience, especially like with my patients, like from the ACB community. Like the doctor happens in the ER all the time. Doctor's like, hey, they're discharged. I've given them the prescription, like, go tell them they can leave. And when I go tell them and I'm like, "Hey, like, do you understand what the pills are for?" Things like that. They're like, "Do I have to take these?" And I was like, you don't have to put anything in your body you don't want to. But this is a conversation that you need to have with the physician and ask what will happen if you don't take these? What are any alternatives? Is like, what are the options? Um,
Hmm.
Even when it's just, the they have high blood pressure, like, go give them this pill and then check on them later. And I always ask them, do you want to take this? And their answers are like, I have to, the doctor said so. So like, I feel like there's two different attitudes like within the community. And I'll be like, no, you don't have to. Like, you have autonomy over your
Hmm.
we are your partners in your healthcare. We're not dictators. And I think that that is the biggest thing that I try to teach in my patient advocacy workshops is they are not dictators of your healthcare, but you have to speak up because
Hmm.
your mom didn't take them. Any
Yep.
pill my mom is prescribed, she will not take it.
Yep.
So I always tell them, and like even when I do trainings and physicians are there, I'm just like, if your patient is not going to take this medication, it is not necessarily going to be an effective treatment plan.
Yes.
Have to try to meet them where they're at, or if they're maybe if this is, say, like, probably the best treatment option for them, you need
Hmm.
to sit down and explain to them why and hear what are their apprehensions and address them and give them the education so they can make an informed choice. Because if they don't take them and, let's just say, like, their blood pressure becomes very uncontrolled and now it's unstable and now they're back in the ER with way more, like, in more critical condition. I think that's a failure on
Yeah.
us as a system because if we just slap the prescription out, send them on their way, and we don't actually, like, meet them where they're at and address their concerns, if you understood some of the values of the ACB community, there's a lot of value of, like, herbal remedies or, like, natural remedies, lifestyle changes, things like that. Medication and pills and going to the doctor for a lot of individuals is not what they want to do.
Not at all.
They're already in front of you.
Yeah.
You have to take that opportunity to educate, meet them where they're at so that they can explain. Because if you can't explain to them well enough, they're not going to take it.
Exactly. Exactly.
Patient, and
Yeah.
you are responsible for your patients. So,
And that was actually my next topic, actually, that I want to mention to you about advocacy. Like, how can we encourage patients to advocate for themselves? Because not everybody can do that. I have a big mouth. I'll say it straight up. I'll ask you, what is this? And that thing that happened with my mom, I want to go back with her. She's, no, 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 I got this. It's okay. I got this. Right? Not everybody is like me. So, how do we encourage patients to speak up because it is their health? How do we encourage it? How do we show them? How do we make them feel comfortable to realize that this is your body? This is you. You don't have to just take everything they say. Just take or put the cream on it or just take this pill or how do we encourage the ACB community to speak up for themselves? What do we need to do?
so I actually developed like a tool to help patients prepare for their appointments. And then I also like when I do my patient advocacy courses, I use like the ABCs of advocacy, like to kind of help them remember four really important things that will help them. Because like you said, I'm also like very outspoken. So if I go to like appointments with my grandmother, like I had to do last night, I'm
Mhm.
asking them all these questions and bringing things up that she's either told me in private or things like that. So um, if it doesn't come naturally to you, my ABCs, like I usually teach that to help. So the A stands for adjust your attitude. So go in there with an open mind. If it's especially if it's a doctor you haven't met before, give them the benefit of the doubt and really just try to be as authentic to yourself and be vulnerable with them and give them the information that they need to help them help you, and just really make sure that you are representing what's important to you and speaking up about that. The B is for bringing backup. Bring somebody with you, like the same way that you were with your mom and I went with my grandmother. Sometimes, if you're not there yet, and especially if you are really unwell, it's hard to advocate for yourself while you need help at the same time. So, bringing somebody else there, expressing your concerns to them so that they can relay it to the practitioner that you're in front of. I always recommend if you have somebody who works in the healthcare sector and that can speak the same language, using like those medical terms, it sometimes can make the process a little bit easier. It shouldn't have to be that way, but unfortunately, that's just kind of the way that it is.
Mhm.
That can also help, and they don't have to physically go. Even like calling somebody on the phone and having them on speaker, can be helpful. The C is for have a concise conversation. I can't
Mhm.
tell you how many times they go in there and they're like, "Oh, my back has been hurting for like 4 months now," but they're there because they have a rash on their shoulder.
Oh.
So it's like prepare for your appointments, which is like the
Mhm.
tool that I created helps them prepare for their appointments. So that you can go in there and really maximize the amount of time because the minute you're talking for too long, like they're gonna miss things, especially like if you're putting some of the pertinent information towards the end of like a long run on,
Mhm.
you're gonna dismiss it and just be like, okay, so like reduce it down to some and over
Yeah. Mhm.
which can lead to like, getting pills for something that you didn't need.
Yes.
And then the last is D, which is document everything. Get documentation. So document your healthcare symptoms, like have a little diary, like a little healthcare diary, a note on your phone. Also, when you go into these appointments, sometimes they'll throw a bunch of things at you, like, oh, this, that, take this, go home and do this, come back if this, and you're kind of like, what just happened?
By
And
the time you get home, you're like, "What?" You
yeah,
just have no idea. Yeah.
exactly, and I'm
Yeah.
literally, like, a nurse as well, and that happened to me, and I was like, "Honestly, like, I'm here because 'cause I'm not feeling well, and I'm not on
Mhm.
my game. Can you please print off, like, what you just told me along with the script and when to come back?" Because that was a little bit overwhelming for me.
Mhm.
And you
And
can
that's
also
a smart idea. That's a smart idea. I've never actually thought about that,
yeah.
asking them to print it.
Ask them, and,
Yeah.
like, they're sitting at like, especially if it's, like, you're at a walk-in clinic or at a doctor, they're sitting at a computer. They have to write a note about why you were there anyways.
Mhm.
Ask them, like, "Hey, like, can you, like, just print off a little something for me?" And accessibility is something that is required in healthcare, so, like, asking as well, if English is not your first language, ask them, "Hey, do you have the capabilities of providing me something, like, in my native tongue?" If
Mm.
it's available, because, like, you also have a right to that as well. So
Mhm.
thing. The hospital that I worked at before, when we sent out discharge papers, our system could actually like flip the instructions into different languages. And I was like, oh, this is perfect. Like, Spanish is their first language. Let me take that extra second to click that button. So now
Mhm.
they have the instructions in something that they understand. So yeah, those are my ABCDs. And then using some sort of tool to stay organized, and writing things down so that you're prepared for your appointments. I think that's probably the biggest thing about, like, how can you
Mhm.
advocate for yourself effectively.
That's a lot of good tips, actually. I've actually got a couple takeaways there too, so that's good. Let's talk about your baby, the Black Birth Project.
Maybe,
Tell
yes.
us some more about this nonprofit.
So the Black Birth Project is, I will say, it's the love child of myself and Cheyenne Scarlett. She is a doula, an early childhood educator, and also now a professor as well, teaching in ECE. So we both came together for a passion for Black women's health, and we actually this happened kind of by accident. So we were following each other on Instagram. I found her research in nursing school when I was looking at Black prenatal health for a project. And I realized we have no data, like race-based data in Canada. Whereas in the States, you know what the mortality rate is.
Mhm.
It's terrible.
Yes.
Spoiler alert.
Mhm.
But I was like, I wonder what it is here, and I couldn't find it, but I found her research. And in following each other, we kind of had a FaceTime call one day and we're like, let's do something. So we put out our own survey and we wanted to survey Black women and to find out about their reproductive healthcare experiences in Canada. And then we also surveyed healthcare providers of all races to see like when it comes to like the ACB community and reproductive healthcare, what are you seeing? What are your knowledge gaps? What tips do you have? And just seeing like what's the other side of it. And we put that research together and literally it kind of snowballed. Like we were featured on breakfast television very early on, like just through our social media advocacy. Then we got a few micro grants to like run focus groups and workshops and just maybe like 8 months later, we ended up just incorporating and becoming like a nonprofit organization because we realized we really wanted to do something bigger and leave a legacy to like actually impact generations to come. And we
Mhm.
did all of this without ever meeting each other in person because I was in Alberta at the time and she was here in Ontario. And we met for the first time, I think, like almost a year later after doing all this work just virtually and on the phone. So we've been really grateful for what we've been able to do in such a short period of time. And so like now we're like applying for grants and really looking to collaborate with a lot of really good organizations in the space like Med Melanin, Sisters in Sync, and different organizations that are really looking to change the healthcare system and like advocate for wellness for ACB women and gender diverse communities, populations within our community. So yeah, we're looking forward to next year, and we really want to educate healthcare providers and empower and educate patients with tools and support them. So we really are trying to do a few things, and we also like to do like hands-on tangible things. So we were able to use some of our funding to like have a huge donation of different items to a house for young mothers experiencing like mental health challenges. So we're
Mhm.
happy to like donate like diapers and wipes and like all these things that like they would need because sometimes it's like the research won't you won't see the effects of the research for a while, but like you need like formula now. So we want
Yes, exactly.
a combination of like things that will have an impact down the road, but also addressing the needs now.
Mhm. That's amazing. I love it. I love it. You touched upon something that there's no map for. Like there was nothing there previously, and that's why everybody jumped on it. It's like, oh wait, that's a good idea. And everybody jumped on it and wanted to be part of it and help you do more research. And that's amazing. That's amazing.
Thank you.
If someone wanted to donate or someone wanted to contribute to the Black Earth Project, how would they do that? What do they need to do?
So right now, because we are open, we're very happy to anybody who would like to donate. We just always like have the caveat, like we are not a registered charity, so we cannot
Mhm.
provide you with like a tax uh
Yes.
receipt for like a write-off, but you're more than welcome to connect with us either on social media, on Instagram, Facebook, the Black Birth Project, or LinkedIn, and go to our website. We have um different channels that you can connect with us. We were trying to set up something like to accept donations, but we just kind of like held off for now just because it was a lot to do like logistically and
Hmm.
like the holiday season. And we just feel like we really want to like, as much as people like really want to help us, we really just want to like focus on pouring into the community that supports us and also kind of taking time for ourselves as well. So yeah,
You deserve.
we're definitely open to it. You can, send us an email, or like connect with us online and we can set that up for sure.
Excellent. And where do you see the Black Earth Project in 5 years?
Oh,
Oh my gosh, that grin on your face.
it's not what you think it is because I think that we are honestly taking it like month by month.
Mm.
Um, I think that a lot of times we really are super passionate and we feel kind of like this responsibility. I think a lot of people are like, "Oh, like ask why are you always doing so many things?" And I'm like, "I don't think you understand like I don't do this because I like it. I feel like it's my responsibility to give back to my community and to really support them knowing the resources and the knowledge that I have and the skills." But it doesn't come without a cost. And it can be, not can be, it is very heavy work. I'm hearing some of the stories, the traumatic stories, while
Mhm.
also experiencing our own traumas, while also being healthcare providers, like on the other side. Um, I think like we really want to see this growing and being something that, where we've actually had policy changes in like connected with hospital management and being able to like create something that like every healthcare provider will be like mandatory training and have accountability for when harm is done and empowering like thousands even like hundreds of thousands of Black individuals across Canada to be able to advocate for themselves and while creating a system where they won't have to so often. So
Mhm.
I I can tell you like what that's our mission and our vision. But in 5 years, like I know that like we really want to grow, but we also want to like take care of ourselves at the same time.
100%.
So we are hopeful that we can make a change, but I don't necessarily have like a in 5 years, like
Mhm.
this is what it's gonna be. We're just really taking it one
Month
day,
by month.
month to month,
Yeah.
trying to take care of ourselves in the meantime. But it would be cool. I'm just putting this out there because I will say this. It would be absolutely amazing to have a Black birthing center in Canada and then eventually have them across um, provinces. They have them in a couple in the US, and it's really sad what's happening with like different legislations and like things that are being passed that are kind of like putting some of them like under financial strain and forcing them to close. But I think that's something that I would love to see. Um, I don't know. I don't think that will happen in 5 years, but I think we're very ambitious and we're very hopeful. Um, but yeah, that's just something that I'll put out there. I'm like, I would love to see that in my
There's
life.
nothing wrong with putting it out there. Put it out into the universe. You never know. And you're on the right path. Like you're passionate about this and you're on the right path. You've got your head on straight, you know what you want, and you're already making a change. You're already making a change. You're helping people. You've raised awareness. You've got people's attention and people are listening. So right there,
We
you're
did. We
that's
also I forget that we did this as well, but we sent a letter to the federal government being like, "Hey, Justin Trudeau, like you're not collecting race-based data and you need to because of this reasons." And we
mm,
had like it was like attached like with a petition and we had like a number of people sign it. And they actually responded to us, which was absolutely amazing. And they're like, "Well, this is sort of what we have in place. Like, like we understand the importance." And we went through their response with a fine-tooth comb and really plan to hold them accountable for the things that they said in their response. So it was definitely like amazing. I was not, like sometimes when you do things and you're like, I don't know what's gonna happen with this, but we're gonna be bold and just go for it. So yeah, when we got the response back, we're like, okay, they're listening. So
mhm.
let's let's keep our feet on their necks and like
That's right.
accountable.
That's right. Like I said, you're making moves, you're making change.
Trying to,
That's
yeah.
that's beautiful. They respond, and it wasn't a generic response. You know what I mean? Sometimes you get a generic response. Well, thank you for your letter. We'll get back to you shortly, or something like that. You might get a generic response from some. It actually gave you details.
Yeah, it was long with like links. It's like we pledged this amount of millions of dollars to this initiative. This is what we're doing. This is what we're doing here. This is what we're doing here. And we're like, okay,
Mm-hmm.
say less. But
Mm-hmm.
this is all fine and dandy. But we actually had we had a project associate working with us, shout out to Kaminda, who actually like went through it, dissected it, clicked all the links, and really looked in and was like, this is all like optically, like this looks great, but like when you actually like go down to how is this going to affect the ACB community specifically, like sometimes like there's not really any like clear measure of how that's
Mm-hmm.
done. So I think that happens a lot. They throw a lot of money at things, but they don't really have plans in place or like they don't really kind of like narrow down to like how is this going to affect the ACB community?
Mm-hmm.
Sure, like yeah, you have like a prenatal like nutrition plan, but like okay, is that getting to our people? And if so, how do you know it's getting to our people?
Mm-hmm.
So yeah, but
They don't realize that they have Kamika on the case. So, they're sending it out and it looks pretty. And like you said, it doesn't show the details, but Kamika's on the case. So it's okay.
yeah, Kamika
You're,
and Chaya, we're
yes, of
on
course.
the
Of
case.
course. Shout out. Yep.
Shout out
That's
to Diane. She couldn't be here today, but definitely like her and I, like we are two halves of one brain of the Black Birth Project, and we have had so many wonderful volunteers that have worked with us as well, that are also passionate and that are also doing amazing things in their respective fields as well. So like we're really grateful to the community around us. We were very grateful. We had the opportunity to deliver a keynote speech at a perinatal mental health conference in Waterloo, delivered by Together Waterloo, where we really talked about how we are going to break down these barriers when it comes to the giving birth for Black individuals in Canada. So we've
Hmm.
had a couple really amazing opportunities to speak publicly about what we're doing. So we're grateful for this as well to like chat with you and on Green Table Talk. So just more people that are listening, and we want people to be passionate about
Hmm.
the ACB community and how like we can make it better for us and everybody else.
Continue to raise awareness. That's basically what it boils down to, right? Continue to raise awareness. You're on the right path. Your group, the team, everybody that's contributing to this, all on the right path. And nothing but success is going to happen out of this. Like there's no other option. Nothing but success.
Amen to that. Thank you.
This is the time where I do our little nugget of knowledge of the day. And this is basically where I present a quote to you that I feel represents you or represents the group or represents what you're doing. And the quote today is from Mr. Nelson Mandela. We can change the world and make it a better place. It's in your hands to make the difference. So we can change the world and make it a better place, but it's in your hands to make the difference. And you, my friend, are definitely making that difference. I saw this and I'm like, yep, that's her. That is her. She's doing this 100% dedicated. You're focused. You know what you want. You've got so much on your plate, and you still make time for yourself, which is very important. Always make time for yourself to go relax on that beach, get yourself focused, centered, and right back at the grind afterwards. So I thank you. I thank you for everything that you do, everything that everyone at the Black Birth Project does. Continue doing you, continue raising awareness, continue to make everybody feel good and feel comfortable speaking out for themselves. And we appreciate you. Thank you.
Thank you. Thank you. I just want to say thank you for this platform. I think it's amazing, just like the fact that the Green Table Talk exists and that you're willing to have these conversations and like publish them publicly so that individuals can see and hear the stories of, some of the guests that you've had, not just, the work that's being done, but like the impact that it's having on our community and like some patients who are going through really, really tough diagnoses. So I'm just grateful that you take the time to like do this and that your team does this. So thank you very, very much. And thank you for having me.
Of course, of course. This is amazing. I'm glad you're here. You could join us. And feel free to come back anytime, talk about the Black Birth Project or anything you feel like it's important to share. And everybody, have a great day. And thank you for joining us on the Green Table Talk. Take care. Bye bye.
Bye.